Okay, I wanted to go over with you how to work out the problems on chapter 15 and 16. Really, how I set these problems up is just like I set the problems up in chapter 12 and 13 and 14. It's all a proportion. So if you can plug in your numbers and figure out what numbers go in what part of the proportion, then you will have no problems answering these types of problems. So I'm just going to start out with the worksheet on chapter 15. Chapter 15 is when we are talking about reconstituting dosages measured in units. So sometimes the question will ask you very simply how many units we'll give. And with those, there's really no type of math at all or equation to work out. You just note how many units the doctor orders. That's how many units you're going to give. Now, the ones that give you units and they want to know how many mLs you're going to give the patient, then you have a little bit of math to work out there. So, for instance, on number 1, and I'm on page 321, which is the first problem on chapter 15 worksheet. So the problem asks or states, your patient with pneumonia receives penicillin V 200,000 units by mouth 4 times a day. You have penicillin V oral solution 400,000 units per 5 mLs available. So it wants you to color in the line on the syringe, which we're just going to work the problem. We're going to figure out how many mLs we are to give. So how I set my problems up is I always put over here on the left-hand side, I always put what I want to answer for. So in this problem, I want to know how many mLs, how many milliliters I'm going to give my patient of this penicillin. Over here, when you work out or you set up your first equation, since I'm solving for mLs here, my numerator over here is going to be mL. And this is the dose that I have on hand. So the dose I have on hand is 400,000 units per 5 mLs. So 5 mLs has 400,000 units. My order, the doctor wants me to give 200,000 units. So since my units is the denominator here, my units has to be the numerator over here. So 200,000 units. And then you just do your simple math across the board. So 5 times 200,000 is 1 million. And that is over the 400,000 units. And then you just divide 100 or 1 million by 400,000, and your answer is 2.5 mLs. So of this problem, of this dose that I have on hand, this 400,000 units per 5 mLs, in order to give my patient 200,000 units of the penicillin, I need to give them 2.5 mLs. Number 2, again, I'm solving for mLs. This one, you have a little picture here. So it says Mr. Curtis has Epigen 12,000 unit subcutaneous injections 3 times a week to treat his anemia due to chemotherapy. How many milliliters will you administer? So you have to look at your label. This is teaching you or getting you into practice of looking at a label and determining what the constitution or what the strength is of medication that you have. So on this label it says this medicine is 10,000 units per ml. It also even does a little bit of math for you, and it says this is a 2 ml dose. This is a 2 ml vial, and so it has 20,000 units in this 2 ml vial. But how I set it up is I just made it really simple, and I just wanted to know how many units does this medication have per milliliter. And it says very simply right there in red, 10,000 units per ml. So that's my dose on hand. So 1 ml equals 10,000 or has 10,000 units in it. The doctor has ordered 12,000 units to be given. So I have 12,000 units over 1 over here. Then I just multiplied straight across the board. And I end up with 12,000 divided by 10,000, and that gives me 1.2 mLs. So I'm going to give my patient 1.2 mLs in order to give them a total of 12,000 units. Quickly, just to kind of point out, on number 3, don't make this problem any harder than it has to be. Number 3 states the physician orders Humalog U100 insulin, 10 units subcutaneously daily at 8 o'clock. So basically, how many units of NPH are you going to give? Well, if your doctor ordered 10 units of insulin to be given, then there's no math there whatsoever. You are going to give your patient 10 units. So don't make that crazy and hard and try to, there's no equation there. I've seen a lot of you trying to turn this into an equation and you really get things messed up. My doctor's ordered 10 units of insulin. I'm going to give 10 units of insulin. If you look on number 6 is the same way in the book. The physician orders regular Humulin insulin 2 units subcutaneous daily at 9. It wants you to tell them or draw a line on how many units you're going to give. Well, if the doctor's ordered 2 units, then you're going to give 2 units of that medicine. Another one that I'll point out, because you will have some of these on your worksheet as well. Number 9, it says the physician orders 14 units of Lente insulin, and he ordered regular insulin 6 units to be given every morning. Basically, then it wants to know how many units total you're going to give. Well, if he ordered 14 of the Lente and 6 of the regular, then I'm just going to add 14 plus 6, and the total number of units that I'm going to administer to my patient is 20 units. So I know there's a few problems on the worksheet that you have due that you just need to add up the total amount of units you're going to give, and that's your answer. There's no other math involved. You're just doing that simple addition. But let's work out a couple more where you actually have a little bit of math that you have to work out. We'll do number 8. Number 8 says the physician has ordered V-Silin K suspension 400,000 units to be given PO or by mouth every 6 hours. V-Silin K suspension is supplied in 200,000 units per 5 mLs. How many mLs are going to be administered? So again, I'm solving for mLs, so that's what I have on the left-hand side of my equation. And the dose that I have on hand is 5 mLs, has 200,000 units in it, and my physician has ordered 400,000 units to be given. So I've set my equation up just like this, and I'm going to multiply straight across. So 5 times 400,000 is 2 million, and I'm going to divide that by 200,000, and I end up with 10 mLs. So of the suspension that I have on hand, in order to give my patient 400 units of it, I'm going to give them 10 milliliters. And last, number 23, and all of these problems are really similar. They're all pretty much the same. So I'm just kind of jumping around here. 23, you have to get your dosage on hand from the label. So again, it's really important that you guys start learning how to read labels, because obviously in healthcare, you're not going to be given an equation. You're going to be given an order and a medication label, and you have to figure out how much to get. So number 23, it says the physician orders heparin 2,500 units subcutaneous every 12 hours for your patient with a jejunostomy. How many milliliters will you administer? Well, my dose on hand is I have 5,000 units per ml. So here I have 1 ml, and it equals 5,000 units. That's my dose on hand. My doctor wants me to give 2,500 units. So 2,500 units is what my doctor has ordered. So this is how you set up your equation. Now I'm just going to multiply straight across the board, and I get 2,500 over 5,000, which ends up being 0.5 or half of an ml. Another thing I'd like to point out that I've seen some of you do with your answers is you're not putting your answers in decimal form, you're putting it in fraction form. And that's all well and fine if you want to do a half of an ml in a fraction form for like this type of problem, but some of you are using it for like if I wanted to give a third of something, instead of just putting 1.3, you're putting 1 1/3. That is not how we document or communicate or write things in healthcare. We use decimal points. We put everything in decimals. So don't be using fractions when you are answering these questions. Put your answer in a decimal point form. On the exam, if you type in your answer in some fraction form, the computer probably will not recognize that or understand what you're trying to communicate, and you'll get it counted wrong. So make sure you're using decimal points. So anyway, that's all the problems I really worked out for Chapter 15. Don't make things any more difficult than they have to be. I just turned the page, and here on number 27, it says, the physician orders 14 units Novolog U 100 subcutaneous injection daily at bedtime. How many units are you going to give? If my doctor ordered 14 units to be given, I'm going to administer 14 units. So those are very, very simple. The only time you really have to do math is when you are changing those units and you're trying to identify how many mLs to administer. So make sure you know exactly what the equation is asking you for. Is it asking how many units to give, or is it asking how many milliliters to give? And while I'm at it, I want to go ahead and just cover Chapter 16 as well. Again, I set up my problems exactly the same as I have ever since we discussed about proportions, I think way back in week 5 or 6. So Chapter 16 on my textbook starts at 363. This is intravenous flow rates. So with these types of questions, we have to figure out what to set our IV pump. We have this bag of IV fluids, and we want to administer this bag in 2 hours. So we have to figure out how many and what we're going to set our pump at. And sometimes you want to know how many mLs per hour, and other times you want to know how many drops per minute. So just make sure you know exactly what you're solving for, and then set up your equation or set up your proportion appropriately. So again, I am working some of the problems on Chapter 16 worksheet. And the very first one, number 1, states that the physician orders 500 milliliters of Dextran to be infused over 24 hours. How many milliliters should my IV pump be programmed for? So again, I am solving for milliliters per hour, and my doctor has told me that he or she wants me to give 500 milliliters in a 24-hour period. So my equation is simply 500 mLs divided by 24 hours, and my answer is 20.83. Well, there is no way that you can give 20.83 of an ml of something. We just don't have measurements like that. So I'm going to round that up to 21 mLs per hour. So if I set my pump to administer 21 milliliters per hour, in 24-hour period time, all 500 of my mLs will be administered. Number 2 is just as easy. Number 2 states a patient with genital herpes, that's a fun one, has an order for a cyclovir 400 milligrams IV piggyback every 8 hours. The cyclovir is dissolved in 100 mLs of 0.9% normal saline and is to be infused over 1 hour. How many milliliters per hour should I program the pump? I am solving for milliliters per hour. I think if you answer that question, then it helps you to focus in on what part of this scenario is important to you. This one gives you a lot of information that you don't even need. The fact that I'm giving 400 milligrams IV piggyback every 8 hours is not even important. I don't even care. I just want to know how many mLs I'm giving. The fact that it's in 0.9% normal saline, don't care. The only thing that I do care about is that I have 100 mLs, and I want to infuse it over 1 hour. So that's how I set up my equation. I'm wanting to solve for mLs per hour. Well, I have 100 milliliters, and I want to infuse it in 1 hour. So very simply, I'm going to set my pump at 100 mLs per hour. Don't make them any harder than it has to be. Number 3. Now there I'm solving for drops per minute. So number 3 says amikacin 80 milligrams is ordered IV piggyback every 12 hours. The amikacin is dissolved in 100 milliliters D5W and is to be infused over 30 minutes. With a tubing drop factor of 15 drops per milliliter, how many drops per minute should be given? So I am solving for drops per minute. So on the left-hand side of my equation, I have drops per minute, and my drop factor is 15 drops per milliliter. So that's the very first thing I'm going to put. Since I'm solving for drops per minute, I need to have drops up here. And my drop factor tubing is 15 drops will give me 1 milliliter. My physician, or my dose on hand that I have to administer, is 100 milliliters, and my doctor wants me to infuse that 100 milliliters in 30 minutes time. So that's my equation set up, and now I'm just going to multiply straight across. So 15 times 100 is 1,500, and I'm going to divide that over 30 because I want to get at that 1,500 in 30 minutes. So I end up with 50. So 50 drops per minute is my answer. More. Number 4, I'm back to milliliters per hour. Number 4 says the physician orders 3,000 milliliters of total parenteral nutrition, or TPN, to be infused from 1900 to 0700. 1900 is 7 o'clock at night. So I basically have a 12-hour time frame from 7 p.m. to 7 a.m. I need to administer this 3,000 mLs of TPN. The question is, how many milliliters per hour should the IV pump be set for? So I'm solving for milliliters per hour. My doctor wants me to infuse 3,000 milliliters, and he wants me to do that from 7 p. to 7 a, which is a 12-hour time frame. So since I'm solving for mLs per hour, I'm just going to simply take my milliliters, 3,000, and divide it by my 12-hour time frame, and that means I need to set my pump at 250 mLs per hour. So just divide 3,000 by 12. Number 5, we're back to drops per minute. Number 5 says Mr. McCain has a peptic ulcer disease and has Pepcid 20 milligrams in 100 ml D5W ordered every 12 hours. All I care about is that 100 mLs of fluid that I need to infuse. The Pepcid is to be infused over 30 minutes, and I have a tubing drop factor of 10 drops per minute. How many drops per minute am I going to give? So number 5, again, I'm solving for drops per minute, and I know that my drop factor, my tubing drop factor, is 10 drops per ml. I have 100 milliliters I need to infuse in 30 minutes. So this is how you set it up, your drop factor and what you need to give. And then I'm going to multiply straight across. So 10 times 100 is 1,000 divided by 30. And I end up with 33.333333. I'm going to round up. You can't give 33.3 of an ml through an IV pole or IV pump. So it's simply going to be 33 drops per minute. I'm going to set my pump at 33 drops per minute in order to infuse my 10 ml bag, my 100 ml bag in an hour, or in 30 minutes. 33 drops per minute. Sorry. Okay, let's do number 15. We're going to go do another drops per minute, just kind of jumping around here. Number 15 says, after a total hip replacement, a patient has an order for Toradol, 60 milligrams IV push every 6 hours over 15 minutes. So basically all that's important to me is I want to give my medication within a 15-minute time frame. The Toradol is diluted in 25 mLs. I have a tubing drop factor of 15 drops per ml. How many drops per minute am I going to give? So again, I'm solving for drops per minute. My tubing is 15 drops per 1 ml, and I have 25 mLs that I need to give in 15 minutes. So this concentration, the 60 milligrams, is put in to 25 mLs. I don't care about the 60 milligrams. I don't care about that concentration at this point in time. I'm not solving for that. I'm solving for my fluid and how quickly I need to infuse my fluid. I have 25 mLs of fluid that I need to get in to my patient in 15 minutes. So that's how I've set up my equation. I'm going to multiply straight across. 15 times 25 is 375 divided by 15, and it ends up being that I'm going to give 25 drops per minute. And then I will get that 25 milliliters infused into my patient in a 15-minute time frame. The last one that we'll do is number 37. I just thought, well, I'll just skip to the back. And that way, again, they're all pretty much asking the same thing. You just have to pay attention if you're solving for milliliters or if you're solving for drops per minute. Number 37 is using a label. So it says a patient with a vancomycin-resistant enterococci, or VRE, has Vioxx 600 milligrams intravenously ordered over 2 hours every 12 hours. How many milliliters per hour should the nurse program the IV pump for? Well, again, my order is to give 600 milligrams of this medicine. And if I look at this label, this concentration of this Vioxx is 600 milligrams per 300 mLs. So I have 300 mLs of a medication that I need to infuse over 2 hours. So it's 300 mLs divided by 2, 150 mLs per hour is what I'll set my pump at, or 150 mLs is what I'll set my pump at. So, if you have a label there, that's where you're going to get your dose on hand. It's not going to be in the equation. So don't get, some of you have been getting freaked out when there's a label and it's not telling you verbatim what the dose on hand is. My order is for 600 milligrams. This label clearly states 600 milligrams per 300 mLs. And I want to infuse that 300 mLs in 2 hours. So here's my equation. Do your division. It equals 150 mLs per hour. So this is chapters 15 and 16. Again, I'm setting it up just like we've set up proportions in the past. I think what people sometimes have a difficulty with is, first of all, you're making it more difficult than it needs to be, particularly with chapter 15. When it's asking for units and you're given units, just tell me how many units you're going to give. The only time you really need to do math is when you are given units, but it wants to know how many milliliters to give. Set it up as an equation. Set it up like this proportion, and the math then should be really easy for you, and you should be able to come to the correct dosage fairly easy. As always, of course, if you have any questions or concerns, just email me, give me a call, and I'll try to get back to you as soon as I can.